Today, I would like to talk about the experience of post-infidelity stress disorder. This term was coined by Ortman in 2005 and is becoming ever more known since many more people are seeking help after infidelity. We see three categories of people in the consulting room in relation to infidelity. There are lots of couples who seek help to deal with infidelity, but we also come across individuals presenting as either the person who has been unfaithful or the person who has been betrayed. Both the betrayer and the betrayed find it helpful to seek help in such stressful periods. The ones who are unfaithful seek to understand what led them to this behavior and how to deal with their partner, whilst the betrayed seek help to deal with being or having been on the receiving end of infidelity. In this video, I shall give a brief overview of the experience of the person who has been betrayed and the symptoms they experience. I will then speak about the experience of the person who has been unfaithful and end with how treatment helps people undergoing such difficulties. Experiencing infidelity could be one of the most traumatic experiences in life. The person comes to therapy initially feeling utter shock, anxiety, confusion, and disbelief, mixed with states of denial. These feelings then pave the way for intrusive thoughts and images of the partner being with another person, sleeping difficulties, and an inability to focus and concentrate. Other feelings that the person who experienced betrayal feels are hurt, loneliness, rage, hatred, shame, doubt, and helplessness, in that one cannot control what the other person thinks or does. These people experience huge drops in their self-esteem and self-confidence, especially if they come to believe that they are to blame for what happened. And some find it very challenging to come to decide whether they are going to tell people about it or keeping it secret from their family and friends, especially when children are involved. Over time, the feelings start turning into a deep sense of loss and depression, in that the person's perception of their past and present become challenged, and dreams they hold about the future become shattered. They lose their sense of trust and safety, and they would need help to start rebuilding it again. This could be a slow and arduous process because the disappointment comes from the person one is meant to trust most in the world. A deep and difficult feeling that the betrayed feels is that of humiliation, a feeling that the partner is or was relating to another person because they themselves are not enough. The problem gets exacerbated because the more one comes to believe this, the more hollow and worthless they come to feel. Some people deal with this trauma by staying in denial because it is indeed very painful to face, but may then turn to alcohol, drugs, or medication to cope with the painful feelings and grief and get stuck into a vicious cycle of destructiveness. Dealing with infidelity is not easy because it involves very complex and mixed emotions. The therapist helps the person stay with and articulate the whole gamut of emotions they experience and to slowly go through the mourning process. The trauma of partner infidelity is more complicated than other traumas, especially if the couple decide to remain together. And there are two reasons for this. Here, living with the betrayer revives and keeps playing out the trauma constantly. Moreover, the betrayed starts losing touch with reality if their partner keeps denying and lying, what is called gaslighting. So the betrayed can start to doubt their own sanity. It is in fact crucial that in these circumstances the psychotherapist helps the person regain their grip on reality and realize that they are not mad and that their intuition is many a time worth trusting and respecting. It is not unusual that the person who has been unfaithful to their partner also seek psychotherapeutic help. Because it's not only the betrayed who suffers when infidelity happens. Indeed, the betrayer usually goes through periods of overwhelm and anxiety around their thoughts and behaviors, especially regarding the hiding, secrets, and lying they get involved in. They fear being exposed, and at times they actually desire to be found out, due to having grown tired of leading a double life. Some can undergo periods of severe doubt, confusion, shame, and guilt about themselves, their choices, and their behaviors. Denial and dissociation, together with helplessness and self-loathing, could impact one's concentration and performance at work and other aspects of their life. It is important that the therapist helps the person who has been unfaithful to talk about their experience, their thoughts and feelings that led to their behavior. It is necessary for the person who has been unfaithful to acknowledge, own, and take responsibility for their behavior, at least in the safety of the confidential space of the consulting room. There are also relational issues that one has to grapple with. The betrayer has to bear the wrath and bitterness and judgment of the partner on discovery of the cheating. They also might fear losing their relationship with their children or other family members and friends. Therapy could help them adjust to their new life after betrayal, either with their original partner or with the new person they are sharing their life with. A crucial aspect of therapeutic work with the person who has been unfaithful is to help them come to understand their personal attachment style and how this might contribute to their behavior. This can be helpful both for the person who has committed infidelity as well as for the one who has been a victim of it. In fact, this could be an opportunity for growth if one takes it seriously and decides to examine their life after the crisis. Some people decide to put in the work and stay together, whilst others opt to leave the relationship. It is worth highlighting a few salient points related to working with infidelity. The first is that some couples unfortunately seek therapy too late in the process, when the damage would have reached an irreparable stage. And secondly, and this is very important, time by itself does not heal. It is through reflection on the experience and processing the thoughts and feelings through the therapeutic relationship that lead to healing. The experience of infidelity presents one with a very deep loss. One needs to give oneself ample time to grieve, however long it takes, bearing in mind that the mourning period is different for every person. Working through feelings and loss is the optimal way towards recovery and regaining self-confidence as a person worth leading a healthy and content life.